The next variables we're going to talk about is place variables. So place variables is referring to the where. There are different place variables that we can look at, including international, national meaning within country. There's also urban-rural differences, as well as localized patterns of disease. So international, we're referring to kind of the global scale. The World Health Organization is an entity that does a lot of international research on the burden of different diseases. They have found that there's great variation from one country to another in terms of infectious diseases, so things like cholera, as well as chronic diseases. The occurrence of disease are going to be affected in terms of this international variation by a number of factors, including the climate in certain places, cultural factors, dietary habits. We know those vary from one country to the next, as well as access to care. The US is one of very few nations that does not have any kind of universal health insurance, and so we have very limited access to care in this country. We also see variations in life expectancy between different countries. So that's also something that's really interesting in terms of that international variation. An example of an international variation that we see is polio. So polio doesn't seem to be something that we really have an issue with in the United States, and the overall incidence has decreased across the world. But there are still places in the world that polio is still endemic. So places like Afghanistan, Nigeria, as well as Pakistan. In terms of national or within country differences, there are many regional differences that can affect the prevalence and incidence of disease. With COVID, we have definitely over time seen a lot of regional differences across the US in terms of COVID-19 rates for different reasons. But thinking about what factors might influence regional differences, we can think about things like weather, dietary patterns, political ideology. There's a lot of different factors that can contribute to these regional differences that we see. An example of a regional difference would be something like our obesity rates for adults in the United States. This is a map of the current adult obesity rates from the Centers for Disease Control and Prevention, and we definitely see some regional variation. The green and yellow areas are going to be those areas with the lowest rates of the prevalence of obesity, and these darker red areas are going to be areas with higher prevalence of obesity. And thinking about some of these variations, there's things like climate that vary. We know that the environment can vary quite a bit. The dietary patterns in these different states can also have quite a bit of variation. So there's a lot of reasons why we see some of this variation regionally in the United States. Urban and rural differences is also a really important area in terms of a place variable. So we tend to see that the burden of disease in terms of morbidity and mortality, it often has really great variation between urban and rural areas. Your textbook gives you an example of elevated lead poisoning occurrences among children who live in older buildings. This might affect urban areas much more so than rural areas, but rural areas might be more likely to get exposed to pesticides and might be more likely to have things like farming injuries among agricultural workers. My dissertation, when I was in my doctoral studies, actually focused on rural and urban differences, specifically in cancer, and looked at how those differences are affected by access to care in rural versus urban areas. So this slide kind of highlights those rural-urban differences. In this slide, what you can see is that the white bars right here, there's a white bar here, these are the most rural areas. And as that color gets darker, it becomes more urban. In this part of the figure here, this is the incidence rate. So what we see is that the more rural areas actually have lower incidence rates compared to some of these more urban areas. However, the death rates in these rural areas actually tend to be much higher than the urban areas. So while it might look like it's a good thing that the number of new cases of cancer is lower in rural areas, what that means is that we're probably not screening well enough for cancers in these rural areas. And therefore, by the time someone is actually diagnosed, they're probably in a late stage or they've already died from that cancer, which is why we see these higher death rates in rural areas versus urban areas. This is often driven by a lack of access to care, a lack of access to screening, as well as treatment services in rural areas versus urban areas. There's also localized patterns of disease that can be associated with specific environmental conditions in a very specific geographic area. So your textbook talks about some examples of lung cancer in radon gas, naturally occurring arsenic in a water supply that can cause all kinds of health issues, different disease vectors. So we tend to see dengue fever cases along the Texas-Mexico border. My doctoral work was done in Arizona, and in Arizona, we tend to see that Native American populations are often exposed to cancer-causing agents in very localized areas of the state for various reasons, but a lot of that has to do with the mining that's been done in those areas.